budgets. So thank you so much for meeting with us regarding the budget for Lebanon County Mental Health, Intellectual Disabilities, Early Intervention Program. I am Holly Leahy, the administrator. And Sue Douglas will be joining me again.
I appreciate you putting them back to back so I don't have to come.
So we do have several items for your review and approval this morning. I'll begin with fiscal year 22-23 contract amendments for providers. This is inclusive of 10 amendments in total, 9 for early intervention and 1 for mental health. These are primarily due to increased utilization of services. The total is $60,831, and these would be covered through our current fiscal year 22-23 budget. So we are not seeking any additional county tax dollars for these contracts.
I'll make a motion to approve the 22-23 contract amendments with, I guess, a $60,831 number there.
Second. Okay, it's been moved and seconded that we approve those 10 contract amendments. Any questions regarding the motion? Not all in favor, please indicate by saying aye.
Aye.
Opposed, same sign, so moved.
Thank you. The next item is for fiscal year 2023-2024, mental health, intellectual disability, early intervention contract providers, provider contracts, and there are 94 in total. This is an amount of $5,430,956, which represents an increase of $627,081 compared to fiscal year 22-23. A few highlights from Sue's memorandum that she submitted to you. We'll first begin with mental health contracts, which is $2,853,173. That's increased by $146,076, or 5% increase from fiscal year 22-23. The main increases are the contract for crisis intervention, which is additional $88,329, increased funding for the new enhanced personal care home of $26,966, a $48,200 increase in the New Start permanent supportive housing program, and increased funding for our psychiatric rehabilitation program in the amount of $62,020. There's also a decrease in the contract for our psychiatrist, and other contracts showed a $1,141 increase as we acknowledge our providers' increasing costs. Then for intellectual disabilities, our non-waiver contracts increased by $83,850, or 8%, and that's because we continue to add new providers and new services for our base funded clients. For early intervention non-waiver contracts, that increased from last year by $324,480, or 32.9%. These are mandated services, so they must be included in our contract. And early intervention is an entitlement program, so we cannot deny them the services. The main service to increase is special instruction, which is almost always county-based funded, as medical assistance does not pay for this service. So we are seeing it in increasingly more amounts of children in need of this service. And I will also say that that is also due to staffing shortages for therapists. So speech therapy is becoming increasingly more difficult to locate, and one of the services that we try to put in place in lieu of speech therapy is the special instruction due to the increase then. And then finally, for support services, contracts were increased by 2.7%, or a total of $65,222. In summation, we are seeking your approval for all provider contracts for fiscal year 23-24, totaling $5,430,956.
Motion to approve.
Second.
It's been moved and seconded that we approve those contracts for 23-24. Any additional comment on the early intervention increase? Beyond what you've said.
We are receiving an immense amount of referrals for early intervention every month. Last month we received 40 new referrals. In this month, halfway through the month, we had received, I believe, about 23 new referrals, and that was just partway through the month. So with the increase in referrals for early intervention, we then are seeing an increased need for services, and thus then you will continue to see an increase in the contracted providers and the amounts. It is something that the state provides the funding. Aside from administrative funding, we do struggle with the administrative funding for that. And Sue, I don't know if you want to comment more on the funding for early intervention.
In the past, and technically we haven't even closed 2021 fiscal year with early intervention because there is still yet another rebudget for us to receive more funds to cover the administrative expenses. So in the past several years, they have been a little more willing to help us fund that deficit. We'll see. We'll have to see what happens.
Does this hold up our 21 budget?
No,
Okay.
no. As soon as that gets approved, then they're going to put their attention to 21-22, which I already have all the numbers in, and the general ledger is already done for what I need. And I'm going to ask for it. I'll see what they can give us, and we'll go from there.
And I noticed that the total amount changed from 5,295 to 79 on your sheet. I got 5,430,000. What were the last three numbers? Was it 900 and something?
956.
Yes.
Thank you.
And again, I'm going off the contract totals from all
Okay.
of the contracts in the packet.
That's all right.
So I do apologize for that discrepancy.
No, that's all right. I know things change, get amended, whatever, so I just wanted to make sure I had the right figure. Thank you.
Thank you.
And that, one last thing on the early intervention, when we talk about, we're seeing, when we spoke with the early intervention with Dawn and Abby in the early intervention department, the kids are needing more speech therapy. Speech therapy is covered by MA, but there aren't any speech therapists. So the only thing you can do is then shift it over to special instruction. Special instruction is not paid by MA, and that's where we're seeing this large increase.
Wow.
Because it's almost, if a child has waiver funding, and there are very few children who are waiver funded, it will pay for special instruction. But it's very few kids. So the county is then tasked with paying for the special instruction. So if anybody knows of anybody who wants to be a speech therapist, send them our way.
Will do. Anything else? All in favor of the motion, please indicate by saying aye.
Aye.
Aye. Opposed, same sign, so moved. Now, the last part.
Thank you. So in conjunction with our provider contracts, I'm also going to do an overview of fiscal year 23-24 agency budget for MHIDEI. So this is our total for all three programs. So our expenses, total funded expenses did increase by $1,269,939, or 17.45%, and are now at a total of $8,546,247. So the reason for that is that last year we attempted to implement a new funding methodology whereby we kept the full contracts with the providers, but we didn't budget the full amount of some of the contracts, recognizing that while many services are mandated, not all services have historically been fully utilized. So last year was the first time that this was presented, and we found that several factors impacted our use of that new utilization methodology, including actual expenditure details for this year, services continuing to move back to pre-pandemic utilization, and several new or expanded programs being funded. We are still using the utilization factors to reduce certain budgeted amounts, but we have adjusted many of the calculations then you are seeing that increase in the expenses, and it's also then increasing our projected deficit for MHIDEI. When we look at our revenues, our projected revenues of $7,663,399 are up $605,382 from our previous fiscal year, 22-23. $233,050 of this increase is one-time funding. So that would be for our current ARPA, Crisis Consultation Grant, and then we also received monies from the Health Choices System for social determinants of health. Again, those are one-time monies to be spent. We're also anticipating $307,044 in anticipated additional revenue for the mandated early intervention services. We are not budgeting for any increase in state mental health or ID funding. And I would be totally remiss if I did not take this opportunity to talk about the mental health-based funding. So we have received flat funding for the mental health base since 2006, and then in 2012 we did have a 10% cut to the mental health-based funding. So I do understand from the Governor Shapiro's proposed budget that he is proposing a $20 million increase statewide to mental health-based funding. We did receive notification from the Department of Human Services, though, that even though that is proposed in the budget, that it, of course, has not gone through the legislative approval process, and therefore we should not anticipate or kind of bank on receiving any type of increase for mental health-based funding. And also to say that that is $20 million statewide. So with us being one of the smaller counties, the larger counties would receive really the lion's share of the $20 million, and we would receive a relatively small amount should that $20 million increase to the base funding be approved. I'll also talk about the deficit, all three programs.
Can you just touch on what the county support then has to fill in when the legislators don't keep up with those numbers since 2006, what that has done to our, local share?
Absolutely. So for the past 3 years, the County of Lebanon and the county commissioners have been very generous in really adding to our budget for MHIDEI in the amount of $600,000 per year. Part of that is for a county match, mandated county match dollars. But then another portion of that is for the deficits that we do have on an annual basis for all three programs. And it also means that as we really try to manage that budget, that we're really not able to move forward with new services and supports, that we really can't move forward with anything in development because we're really just trying to hang on to everything. Crisis intervention, which is a countywide service, has increased greatly over the last 3 years. We have had a tremendous increase to the budget for crisis intervention. Without the aid from the county, we would not be able to manage our overall budget, and it would mean that we would have to cut services and supports in the county for individuals that we serve. So we are very grateful to the commissioners.
Jimmy, anything to add?
I'd love to. This is from the emails you all are copied on when I appeal to the legislators. I'll repeat what Holly said. Flat funded from 2006 to 2012 and cut 10% in 2013. Nothing since. Well, I shouldn't say nothing. There was an allocation last year that was added. I forget the dollar amount, but it turned out it was similar to the proposal I think that Governor Wolf had put in. The legislature had approved a portion of it. Turned out then half of that allocation went to state agencies. Didn't make its way to county level. I can't think of any other service that we provide that has suffered this kind of funding cut and stagnation over the last 15 years. It has to be addressed at the state level. And it's not just our MH agency. It affects behavior with children and youth and at the jail and drug and alcohol abuse. Mental health is through so many of our departments. And it's not just this cost that Holly's talking about that is borne by the county. I mean, we're spending probably millions of dollars.
Oh, yeah, that's the part.
On mental health, you know, fallout, so to speak, for lack of a better term. And year after year, it's proposed. Year after year, it's either entirely cut out, or again, for the first time last year, there was an amount put in there, but it was less than what was proposed. I am just hoping this year, finally, there will be some sort of a sizable allocation. Again, she explained how the $20 million would get spread around. I mean, you know, without doing calculations, that might catch us up to 2008, you know, or 2009 or something. It's frustrating year after year. You know, the county has, in my view, no choice but to meet this need. You know, it's not a gift to mental health, it's a need. And I don't know what it would look like if the county didn't do this to fill in these deficits when they happen. And it certainly has contributed to the county's overall budget and to the millage increases. There's no doubt about it. I really, really hope that this is the year that something is done at the
May
state
I
level.
piggyback on your statement? It's really frustrating to me because what I've observed is not only do the budgets not increase for mental health, but the state hospitals close down, Warnersville, for instance, and that means there's nowhere for someone with mental health to go, and they end up in our jail. And so then we have to work with the mental health issues there, and it's not fair. It's not fair to the people. It's not fair to the people who have the mental health problems. And then they go for help, and there's no rooms for inpatient. I mean, they're out of them. So where do they go? How do they survive? Many become homeless. Luckily, we have a VA that helps some of the veterans, but it just goes on. And, you know, we can plead with the state legislators, but they've got to hear us. They've got to do something. We are at a crisis point. More and more people, because of COVID, have had mental health problems, including our children. It is so sad. You know, we can't just turn our head and look the other way anymore. It's time to step up to the plate and take care of this. Thank you.
I got add to just well stated, both of you, because you stated earlier the commissioners have been very generous. I don't think it's a no-brainer, and it's we probably should be investing more because, again, it's just an investment to try to keep our costs down with this population, if not served, ends up with bigger problems that can cost us more in prison, and I can't even measure the heartache in families. You know, I don't know how to put a price on that, so God bless you for your work.
Thank you.
We are desperately trying to hang on to every contracted provider, every service and support, and you know, without increased funding, that is going to be truly a challenge. Even when we look forward to, you know, possibly some funds, it is not going to backfill the amount that is necessary to really give adequate funding to the mental health-based funding system and everything that it provides within our community and all the individuals that it supports. And we are desperate for the legislators to hear our pleas and to understand how necessary this mental health-based funding is, and funding for other things such as 911, which really addresses our crises here in the community. So we are hopeful that this year they will hear that, but again, I will caution that at $20 million statewide, it is not sufficient to backfill what is necessary for the program.
Probably open the door on 911.
Gosh, I don't know, do you want me to talk about that or that? I would just say that the two largest priorities in the County Commissioners Association and for counties across the state this year are mental health funding and the reauthorization of the 911 fee. I mean, those are both really big ticket items. The 911 fee needs to be reauthorized and, or it sunsets, and it is no longer. That's $3 million that comes to the county. So, you know, that's working its way through right now, but, you know, anytime you run across a legislator at any of your ribbon cuttings, you know, please fill their ear.
On both issues?
Yeah.
Yeah. Okay, I think, thanks for shining a light on all that. That's, every once in a while, we need to remind ourselves where we are with the funding, so this is a good time. Nathan, we want to continue?
Sure. So I do want to then really speak further to the county funds. When adding the deficit to the required county match contribution of $353,000, this equals $1,236,000 in county funds to support our proposed fiscal year 23-24 budget. This is an overall increase of $700,000 from our support requested for fiscal year 22-23. We do not anticipate requesting an increase in our county funds for 2024 above the $600,000 that we have received each of the last 3 years. So we're really going to try to manage that budget as much as possible, recognizing that, you know, we are over about $700,000 over that county match dollars for 2024. So I will say, as always, we will work to manage those contracted providers and really manage that budget so that we can stay within the amount of support that we have requested in previous years.
Well, thank you both for all you do.
And I have to say, and I've been doing this a long time, longer than I admit, like 17 years. And just as a side, I could not have done it without Carol Davies. She was my mentor for
She's
6
a brilliant,
years, and
yeah,
she
mathematician.
just taught me that the numbers are the numbers, and you need to, you know, you need to look at them, you need to manage them, and very detail oriented. And I love her to death.
Yes.
But again, you know, I've been doing these budgets for 17 years now, and the budget has really barely moved. I mean, and that's why we tried that utilization. To bring it down to where we really think we're going to be spending. But you need to have all those providers in there. You need to contract. People need to have, there's always talk about choice for the people who are getting services, that they have to have the choice of providers. So we are doing the best that we can. And, you know, we're looking at every invoice that comes. Yeah, you're looking day to day at every invoice that comes in, we're checking it, we're making sure everything is right, and you know, only paying for what we're supposed to be paying for. But it takes a lot of time. It does.
Thank you.
So.
Anything else, motion?
Motion to approve.
Second.
It's been moved and seconded that we approve the budget for 23-24. Any additional comment or question? If not, all in favor, please indicate by saying aye.
Aye.
Aye. Opposed, same sign, so moved.
Thank you
Thank
so
you.
much.